Are we ready to start? Great. Well, welcome everybody. My name is Tammy Duckworth. I am the senator from Illinois, well, one of the two senators from Illinois. When I was asked to moderate tonight's discussion, I immediately said yes, because these are the kind of conversations that are happening in my own state of Illinois and across kitchen tables and in doctors' offices and hospitals all across our country. Before we get started, I want to introduce our panel of healthcare providers to Georgians across the state. So let's welcome our panel. Dr. Karen Kinsel is the only doctor in Clay County. She has been operating her practice in Clay County for over 20 years and has been the only physician in town for the last 15 years. Dr. Chris Ellis is a nephrologist in Macon, Georgia, and is affiliated with multiple hospitals in the area. Dr. Ellis is also the founder of Physician Consultants of Georgia. Dr. Anurag Sahu is a cardiologist in Atlanta. Dr. Sahu is affiliated with Emory Healthcare, and he has been in practice well over a decade. And of course, the star of the show, Dr. Reverend Raphael Warnock. He is the senior pastor of Ebenezer Baptist Church and the Democratic nominee for U.S. Senate in the January 5th special election. Throughout his public service, Reverend Warnock has fought for quality, affordable health care, for the dignity of working people who are paid too little as our government works more for Wall Street, and to make sure that every voice is heard. I'm so proud to be here. I've gotten to know Reverend Warnock, and I'm so pleased that he is addressing this very important issue. Thank you all very much for joining me. So let's dive right in. I'm going to start off, Reverend Warnock, you get the first question. Why have you made healthcare a center of your campaign? You often say healthcare is on the ballot. What do you mean by that?
Well, thank you so much, Senator Duckworth, and it's wonderful to be here with everybody. I'm grateful for your leadership in the United States Senate, and I'm looking forward to joining you there in a few weeks to do this work. And I'm grateful especially for the healthcare providers who were a part of this call, folks who really are on the front line, Dr. Kinsel, Dr. Sahu, Dr. Ellis. Thank you so much for the work that you do. Listen, my candidacy is leading with healthcare. There are a number of issues that I'm concerned about, but I don't talk about any issue more than healthcare. And that's because I've been focused on this work for years. I believe that healthcare is a human right. And it is certainly something that the richest nation in the world can and ought to provide for all of its citizens. I often say that voters don't vote for politicians, they vote for themselves. They show up to vote their interests, and they have to see themselves in the conversation. And so I hope that the voters of Georgia understand how much really is at stake in this runoff election. We have flipped Georgia blue. Joe Biden is the president-elect. Kamala Harris is the vice president-elect. They have won Georgia. When they finish recounting the votes, it'll be clear that they've won Georgia. But our job, our work here is not done. They need a Senate that's going to help advance that work. And so I'm grateful to be running alongside my friend, John Ossoff, in this moment. And this is the work that we must do. When we were trying to pass the Affordable Care Act in Georgia, or pass the Affordable Care Act in our country, I was preaching about it from my pulpit. And when Georgia refused to expand Medicaid several years ago, in an act of civil disobedience, I stood up in the governor's office, said we must expand Medicaid. And so I've literally been putting my body on the line. Dr. King used to say, of all the injustices, inequality in healthcare is the most shocking and the most inhumane. So healthcare was already a pressing issue, but it's made even more pressing. And the disparities have become even more glaring in light of the COVID-19 pandemic, which has highlighted longstanding disparities in access to affordable healthcare. So this is the work that I'm committed to doing, and carrying the concerns of ordinary Georgians to the U.S. Senate. Finally, let me just say that I've been moving all across this state, and I've been going to not just to the larger urban environments, but to small rural towns. And when I stop by those small rural towns, they're surprised that I'm there. And I'm surprised that they're surprised. But they said, we don't see too many people running for the Senate drop by our small town. But I'm running to be the U.S. Senator for all of Georgia. And I was down in Cuthbert, Georgia, not long ago with Dr. Kinsell. The folks in that area, Randolph County and that part of the state, are concerned because their hospital is closing or has closed. And a lot of these hospitals are closing. We've had 8 to close in 10 years in Georgia, in large measure because we refused to expand Medicaid. I'm running for the Senate to make it easier for Georgia to do what already is something that we certainly ought to be incentivized to do right now, and that's to expand Medicaid. But there are some things that I can do at the level of the U.S. Senate to make it even easier. And so that's the work I'm committed to doing. And Georgia is on my mind, and healthcare Georgians is on my mind.
That's amazing, Dr. Warnock. I think it's so important that healthcare is a central part of your campaign because it is a basic human right. And I think what we've seen with the COVID-19 pandemic is the systemic racism that exists in our healthcare system. In Illinois, for example, we have one of the highest rates of, and we see it all across the state in different ways. And your mentioning of the rural communities is especially important. I'd like to bring Dr. Kinsell into this conversation. Can you speak specifically to rural communities? I mean, why has healthcare in rural areas been neglected, and what has been the effect of this neglect on your community?
Well, thank you, Senator Duckworth. I've been here over 20 years, and of course, like most of rural America, the population has declined, but the healthcare has declined even more rapidly. My particular county did not have a pharmacy for 2 years. That meant it was a 30-mile round trip to get a pill. We've also lost 3 hospitals permanently within 50 miles of here. One of them, as Reverend Warnock just mentioned a few weeks ago, in Randolph County. So it's about 100 miles between hospitals in certain directions out here now. And even though we do have EMS, and that's great, there comes a point where the access to healthcare simply does not exist, whether people have money or they don't. And by Georgia refusing to expand Medicaid, we're turning down so much money that we desperately need and that we already pay for. About 500,000 Georgians would be covered if our Republican leaders took action, but they refuse to. Despite Georgians paying the federal taxes that pay for Medicaid in Illinois, for example, in California, New York. I think if people understand that, it would make them kind of mad, but we act like that's not the reality when in fact it is. Georgia, in fact, is 48th in insurance status in the United States. That means there's only 2 states who are worse than we are in terms of the number of people who are covered. It's just absurd. We're the home of the CDC. Over 70% of voters support expanding Medicaid access. I believe we're turning down something like $5 billion a year by not accepting it. That's fiscally irresponsible and just unacceptable.
Very good point. I would like to bring Dr. Sahu into this discussion on Medicaid. What has been your reaction and what has been its effect on your patients to Georgia's repeated failure to expand Medicaid?
Yeah, it's a good question. So first, thank you guys for having me. I really appreciate the opportunity. But the Affordable Care Act was passed on March 23rd, 2010. So that's a little bit more than 10 years. And we all, the common talking point is that's 500,000 Georgians that could have been covered. But really, over 10 years, that's millions of Georgians that could have been covered. undoubtedly know someone, if you live in Georgia, that could have gotten Medicaid and could have had a better life, but didn't because we chose not to act. And as a physician, that's heartbreaking. I can't tell you the numbers of people I've taken care of in my ICU that couldn't afford their prescription medication and they come in crisis for absolutely no reason. We're not only squandering money, like Dr. Kinzel mentioned, but we're squandering the lives of Americans and Georgians in particular because we have chosen not to expand it. And people always say that we can't afford Medicaid expansion. We can't afford it. It's too expensive. But we spent $1 billion on COVID at a state level this year. And we could have spent $100 million and expanded Medicaid to cover 500,000 people. It would have saved lives 10 years ago, it would save lives today. And then on top of that, our Georgia Attorney General with Senator Loeffler's support, they're at the Supreme Court right now trying to take away protections for people with prior medical conditions. All of it is just a travesty.
Thank you. Wow, y'all, we did not practice this, but each speaker has actually introduced a topic that actually segues into the next speaker. And so it's such a natural flow because this is such an important issue, but we did not actually practice this at all because I wanted to speak about pre-existing conditions next. And I would like to bring Dr. Ellis into the conversation. I myself have a condition. It's very interesting because I didn't, and we all hopefully, I always say, I hope that we all live long enough to develop pre-existing conditions, because if you live long enough into a ripe old age, you're going to have a pre-existing condition. And if you don't have one yourself, you probably know or love someone who does. And so Dr. Ellis, you've talked before about why I think pre-existing conditions in particular is a critical part of healthcare. And could you say a little bit more about that?
Absolutely. Thank you, Senator Duckworth, and all the panelists. And thank you, Reverend Warnock, for having me. Each of the other physicians mentioned, very interesting key points that, kind of leads into this question, as you said, Senator Duckworth. We've been practicing crisis medicine. And, access to healthcare coverage isn't a luxury for my patients. It's literally a matter of life and death. Imagine, and this is the discussion I have with many of my patients, having to choose between getting their medications, seeing the doctor, or basic necessities like eating or caring for a loved one. These are the decisions that, many of these patients have to make. And, just quite frankly, we can do better than that. And those who are less fortunate deserve more. Prior to the passage of the Affordable Care Act, many people with kidney disease had challenges getting healthcare coverage because they had a pre-existing condition and could be denied insurance. Many who did also incurred unaffordable monthly premiums. Today, thousands of Georgians each year depend on the Affordable Care Act's protections for pre-existing conditions to get the life-saving kidney treatments they need to stay healthy. Empathy requires that we not look at healthcare from a corporate standpoint, but rather from an individualistic one, indivisible from the needs of the least of us. As Georgia hospitals struggle to stay afloat during this pandemic, threaten the quality of care for kidney disease patients and other patients with pre-existing conditions, Washington politicians like Senator Kelly Loeffler continue to undermine Georgians' healthcare. We've got to do better.
Well, thank you. And let me just make something clear that about your current two senators and what they support. Because I've been here in the Senate now for 4 years, and the Republican bill and the Trump bill that they claim will not take away insurance from people with pre-existing condition. When you hear the rest of the story, you hear how harmful it is. It is true that the legislation that they are putting forward would not allow insurance company to deny you insurance if you have a pre-existing condition, but it does allow those same insurance companies to deny you treatment for your pre-existing condition. So you can actually still buy insurance under the plan that Senators Perdue and Loeffler support, but the insurance companies get to say, oh, you have diabetes, we're not going to cover your insulin. Oh, you have cancer, we'll still sell you insurance, but we're not going to cover chemotherapy. That is the hidden rest of the message. So when you hear them say, hey, I support protecting people with pre-existing conditions, they can still get health insurance, yes, but that plan allows insurance companies to deny you the treatment you need for those pre-existing conditions. What's the point of having insurance that doesn't cover your particular condition? It is inhumane. I'd like to get back to Reverend Warnock and maybe get your reaction to that. But also, you've said that healthcare is not just a political issue; it's a moral one. What are the moral issues involved in healthcare?
Yeah, thank you so much, Senator Duckworth, and I appreciate your pointing out the fact that these so-called plans that are being laid out by the Republicans are no plan at all. Simply announcing that you're going to cover pre-existing conditions does not answer the question. This work requires not a pronouncement, but an actual plan. And these so-called, and I mention this, I want to emphasize this because Senator Loeffler recently laid out her so-called plan for healthcare, and it does not ensure that people with pre-existing conditions will be covered. It does not prevent insurance companies from essentially not providing you with the care that you need. And that, I think, is immoral. I'm a faith leader. I believe that we are tied in a single garment of destiny. And for those who feel like that's just utopian, thinking that's not connected to the real world, I think this COVID-19 pandemic is a teachable moment, because it's always been the case that I need my neighbor to be covered. But a situation where we found ourselves in the midst of an airborne deadly disease in which my neighbor can cough, and that potentially leaves me imperiled. That means that I'm tied to my neighbor. I should want that person to have healthcare coverage. When there's a vaccine available, I should want them to have access to it. I should want them now to be able to get tested so that their situation can be appropriately addressed. That should have been clear before the pandemic. It's exceedingly clear now. So what I'm saying is that the moral argument and the practical argument are actually inextricably connected. That is to say that the right thing to do, as it turns out, is also the smart thing to do. It's right in a country as wealthy as ours to make sure that people have access to affordable health care. That's the right position morally. But as it turns out, when we don't cover people, we end up spending more money. As has been pointed out by other panelists tonight, it's not that we cannot afford to expand Medicaid in this state. We cannot afford not to expand Medicaid in the state. And so we see that in terms of the rising costs by the time that people get to Dr. Sahu's office. Certainly by the time they get to Dr. Ellis's office, who is a nephrologist, and they have advanced kidney disease, there's a whole range of chronic illness and preventative care that people did not have access to. So that by the time they get there, they're in a crisis moment. It's a crisis for them. And it is a financial crisis in terms of the cost on the overall healthcare system. The right thing to do is also the smart thing to do. It makes more sense to cover everybody rather than have people show up at the ER unnecessarily. So after years of their issues not being treated, not being able to afford prescription drugs, creating a life and death situation for them unnecessarily and costing us a lot more than it would have if we had just covered them in the first place.
Very good point. And then I'd like to bring Dr. Kinso back into the conversation. Following up on that about the right thing to do is also the smart thing to do. Since you see things from a rural perspective, can you talk a little bit about what is the first step that is the right thing and the smart thing to do in order to improve rural healthcare?
Well, you can't have a system without a plan and money to make the system run. I mean, currently at this point, I mean, basically the system is no system. If you leave things up to a for-profit imperative in a system where there is no profit, it's not going to work. Rural Georgians need what everyone needs. We need access to healthcare. We need an economy that takes care of everyone. We need someone who fight for us, like Reverend Warnock. He's fought tirelessly for Medicaid expansion. I'm a little jealous that he got arrested for Medicaid expansion. I haven't yet, but maybe if I hang around, I can attain that. But let me say something too about this pre-existing condition thing. Pre-existing conditions are kind of like virginity, okay? You only don't have a pre-existing condition once, okay? Everybody in the doctor's offices and in the hospitals, they're sick. They have pre-existing conditions. And everybody's born, everybody dies, and most people get sick in between. To make some artificial definition in between the people who are healthy and everybody else, which is pretty much all of us, it just doesn't make any sense. Our country was founded in the Declaration of Independence that we have the right to life. We did not have sophisticated healthcare at that point, but if we did, that's fundamental to the right to life. Jesus cared for the poor and cured the sick. These are our fundamental core values. And for anyone to argue against that, for example, with this ridiculous waiver that Georgia's just accepted, which will cover about 10% of people who would normally be covered by Medicaid, there'd be a work requirement. What about all the people who are applying for disability? And that's a good proportion of the people who need Medicaid expansion. What about the people who are caring for grandma who's sick? Are they supposed to not have health care just because they are otherwise involved in the system, in the world? It just doesn't make sense. And it is so frustrating as someone who's trying to provide health care. People come in, they broke their knee. We know how to fix that. I can't get them into any place to have a 30-minute operation that would allow them to work for the rest of their life. Instead, they sit around for 2 years and they get disability. That's absurd for the entire economy and for that person. I'll shut up now. Thank you.
No, you're making sense and you're
you.
funny.
We can listen to you all day, Dr. Kinso.
Okay, well, then you know.
Well, and then you have some people who are born with the pre-existing condition. My daughter has a thyroid issue that was discovered with her birth screening blood test. So from the minute that she was born, she never had a life without a pre-existing condition. And then you see kids who, could have these lifetime caps that insurance companies used to have that are now gone thanks to the Affordable Care Act, but that could come back as well. And that's really scary, especially for parents. Yeah. Looking at what are we going to do with my child, we'll bump up against those lifetime caps pretty quickly. Dr. Sahu, I want to bring you in, you see things from a different angle sometimes. And do you have anything you'd like to add to Dr. Kinso's answer for healthcare elsewhere in the state?
Yeah, first thing, I'll never think of pre-existing conditions the same way ever again. That's probably the biggest take home. But this weekend I had a chance to read Senator Loeffler's plan for expansion of healthcare. And honestly, at the beginning, I was excited. I was like, okay, the plan may be different from the Democrats' plan or Reverend Warnock's plan, but if it gets to the same endpoint, the same people are covered, we give good healthcare, like maybe I could be okay with that as long as we're doing the right thing. But I read it, and it's absolutely horrible, her plan. And Dr. Kinso touched upon the Medicaid waivers, which Senator Loeffler talks about a lot, but she also talks about the use of temporary insurance and expanding that to almost 364 days a year. And I take care of patients with those brokerage push temporary insurance plans. And those plans are horrible. They don't cover pre-existing conditions. And even if it wasn't a pre-existing condition, many of them will still claim, well, you had it before and now it's discovered, so we still won't cover it. It leaves massive gaps in coverage, massive upfront payments. It's like buying a junk bond, except that if you lose it, you lose your life and not just money. Yeah, it's horrible. But I don't pretend to have all the answers on how to solve healthcare. I don't think any of us do. But what I think we need is a team of people that are thinking about this in a very logical and scientific way and understand that public health should come before politics. We need leaders who trust the CDC, leaders that believe in Fauci, in the FDA. We need leaders that believe in FEMA and Health and Human Services and not use those agencies to manipulate data or goods for a political purpose. We need to elect leaders that tell the truth and will follow the scientific method and not what we currently have.
Thank you. And Dr. Ellis, what are the concerns that you're hearing most often from patients?
Well, most of my patients are concerned about having enough, having enough for just the basic necessities. And unfortunately, for many of them, that doesn't include their medications. Listen, we are experiencing an inferno of healthcare inequality, and we're going to be overwhelmed by chronic disease treatments if we don't fix this. Reverend Warnock said something very poignant earlier, is that the right thing to do is a smart thing to do. Well, the smart thing to do is the right thing to do. He phrased it very well. Many of our patients have been told, from the beginning, do 3 simple things: eat right, exercise, take your medicines. Well, when those 3 things are challenging to people from the beginning, it becomes a problem, because as we sit here and talk as policy leaders and healthcare professionals, those 3 things seem very easy for us to accomplish. But many of our patients are challenged by all 3 of those things. And until we make those basic things easy for patients, we're going to be continuing to chase our tail and trying to treat these health disparities. When it comes to kidney disease, most of the diseases I treat are preventable. Diabetes, hypertension. If people were able to afford healthier foods, if they're able to afford their medications and control their diabetes and hypertension, they wouldn't suffer the end stage effects of these treatable diseases, namely, kidney disease, heart failure, stroke. These type of things are what burden our healthcare system. So I think in order for us to start to solve these problems, we've got to start to kind of focus on some of the basics necessities that people need. And many of my patients, face out-of-pocket costs for medications. Not to mention patients who are lucky enough to get a transplant. If those patients have no means or ways to cover their medical needs after a transplant, well, then they can't afford their medications, their immunosuppressive drugs that are so important to maintaining a kidney transplant. I feel like our policy making has to be proactive, contemplating the future instead of reactive, based on outdated information or false information. And, for me, it's a simple thing of humanity. The Affordable Care Act helps us to bridge that gap so no one is left behind in this healthcare paradigm. It's a way for us to ensure that no one has to do without. Medicaid certainly tightens the gap for many of the underprivileged, but we can do so much more. We have to do just the minimum for those who have the least. I don't think that's asking too much. I hope I answered your question. This is certainly a passionate issue for me because it's a day-to-day struggle for me with younger people, people who look just like me, people who come from the same place I come from. And it's certainly an inequality and it's not fair. And I'm certainly dedicated to doing everything we can to fix these problems. So thank you.
Thank you, Doctor. You know, in Illinois, we have some places, I have an entire county, for example, that has no grocery stores. You actually have to drive to Paducah, Kentucky, across the river, the Ohio River, in order to go grocery shopping. And the only place that they can buy food other than a fast food place is actually the Dollar General. And so people have such limited choices. Reverend Warnock, what are the major differences? I heard, we heard just now Dr. Sahu talk about Senator Loeffler's plan. What are the major differences between your plan for healthcare and your opponents?
Well, Senator Loeffler's plan encourages other states to do what Georgia's done and to get disengaged with healthcare.gov. The folks who looked at her plan have suggested that would leave 100,000 less Georgians covered. So that's one thing. Number two, she agrees with Congressman Collins, who was in the earlier part of this race in the general, with the effort that would prevent us from being able to negotiate the cost of prescription drugs. I think that the big pharmaceutical companies have enough representation in Washington. And so I'm not going to Washington to represent them. I think they've got enough representatives. I'm going to represent the people. And I think it's absurd that we would think that they shouldn't have to negotiate the costs with one of their biggest purchasers, which happens to be the government purchasing the drugs on our behalf, so that we drive the cost of prescription drugs down for our mothers and fathers, grandmothers and grandfathers, others who use Medicare. Her plan doesn't answer that issue. And driving down just the cost overall for healthcare. And then we've got 1.8 million Georgians who have pre-existing conditions, which is a big part of what we're talking about here tonight. And I just think it's important, again, for us to underscore who we're talking about when we say pre-existing conditions. We're talking about your child who has asthma. We're talking about your mother who may be a survivor of cancer. We're talking about the people that your coworker who is dealing with diabetes, hypertension, whole range of issues. And now with COVID-19, a whole lot of other people with pre-existing conditions. In fact, prior to the Affordable Care Act, in some ways, being a woman meant you had a pre-existing condition. And so a plan that that allows loopholes for insurance companies to deny you coverage or not to provide you what coverage ought to be able to, what you would assume coverage gives you, and that's actually access to care, is no plan at all. And so the differences between her whole philosophy and approach to healthcare in mine is vast and very significant. And that's what's at stake in this runoff election, which is why I need you to tell your friends that healthcare is on the ballot. If you care about your healthcare, if you care about the healthcare of your mother and your father and folks who you care about, and you're not registered to vote, you have until December 7th to register to vote. You can do something about that. You can go to the website for the Secretary of State and register to vote. And then you can request your mail-in ballot. It's safe to vote by mail in Georgia. Early voting in person begins on December 14th. And so we want to make sure that word gets out. Beginning December 14th, people can vote in person, early voting, and then election day which should be the culmination and not the beginning of our effort to vote in this voting season, is January the 5th. Healthcare is on the ballot.
Yes, it is. And the thing about negotiating for lower drug prices, I get my healthcare through the VA, and the VA has been able to
Right.
negotiate for lower drug prices for years now.
Right.
And so you have one branch of federal
Right.
government that can do it, and then another branch of federal government that can't. And that right was given away by President Bush, who allowed this bill to pass that would prohibit Medicare from negotiating for lower drug prices. I want to make sure that I'm cognizant of the time we have. We have several questions from the audience. As we go into those, I'm going to ask all of our panelists to think about what you think our audience members should take away from today's discussion. If you were to boil everything down to a single essential point, what do you think that would be? And well, I'm going to ask you that question in a little bit, but I want to go ahead and get into the audience questions because I want to make sure we address all of them. What we have now are questions from the audience that was submitted beforehand. There's 5 of them. The first one is from Carter in Alpharetta. He asked, how can we lower the cost of COVID tests and treatment? Does someone want to grab that? Or I can.
I'm happy to let the senator or the Reverend answer. I don't want to.
Let me just say,
go ahead, Senator.
When we passed the COVID response package, the CARES Act, right? And we have this other bill that the House passed 4+ months ago. It can be in that rescue package that we would provide low cost or free testing. Because if you are working, supplying my daughter with chicken McNuggets, you don't have $50 a week to go pay for a COVID test. If you can even find one for that cheaply. And in fact, we need to make sure that we put into the rescue package money to, if we can provide funding to rescue the airlines, we surely can find money into the package in order to allow people to be able to afford to take a test. Because the only way that we're going to get out of this pandemic is if people can test when they need it, anytime they need it, so that they know that they're choosing between a paycheck or getting tested, because that's who's going to be spreading it, are the people who are asymptomatic or the people who think they may be sick but are too afraid to go get tested because they either don't have the money or they're afraid that they can't afford to go without a paycheck. They're giving away literally hundreds of billions of dollars to the airlines. They're important, but we're not taking care of the people who are actually the ones that are able to stop the spread of this, because they're the ones that need to stay home. So that's my little soapbox. Anybody else want to touch on low cost free testing whenever? Don't you want your kids to go to school?
In Georgia, the health department
Go
does
ahead.
provide free testing. There are some issues with it. In our case, a nurse covers 3 counties, but health department testing is free in Georgia.
Yeah, certainly. A lot of counties.
Do you have to have symptoms though? Because in Illinois, you actually they were asked for a while, you had to show symptoms before you could go get the test. And a lot of people are asymptomatic. Dr. Sahu?
Well, yeah, I was going to raise that point. Like, there are counties in Georgia, and most of them you can actually get free testing. But the problem with that is there's only 1 or 2 people available to do the test. You may have symptoms. You have to wait 4 days to get tested. And then it takes another 5 days to get the results back. By then you're already in the 2-week quarantine completed. So what's the point of the test at that point? It needs to be much more rapid, much more readily available. And frankly, it should be at no cost, because if you have to choose between getting a COVID test and getting groceries or paying your bills or your rent, you're probably not going to get the COVID test.
Well, and a specific issue in Georgia is that they had not been not counting the rapid tests. They just recently added that to the website, but it's not in that curve that you see at the bottom of the website. And that's probably the only way we're going to get ahead of the pandemic.
Our next question is from Gretchen in Henry County. She wants to know, what would you say to win over people who don't think the Affordable Care Act is worth protecting?
Reverend Warnock or
Go ahead, doctor, and I'll respond after you.
Okay. Well, I'll take a little more narrow point of that, which again is back to what we keep hammering about Medicaid expansion in Georgia. Okay, people need to understand they're already paying for that Medicaid. If you pay federal taxes, anybody in here pay federal taxes? That goes into a big pot, which is divided up and pays for Medicaid in 38 other states. Okay. That should make all of your friends angry. And if you explain to them that way that you've already paid for it, and our governor and our Republican legislature is refusing to take the money back. Now, the example, if they were going to offer us $5 billion to build a highway in Atlanta, which is probably about what it costs, we would take it. You know, why the heck would you specifically refuse to take the money that would save the lives of your fellow Georgians?
Right. It makes no sense. And, you know, we've heard the Republicans for years talk about repeal and replace. But come on, I mean, after 10 years, you've heard a lot about repeal and there's been no plan. And it's because they don't have a plan. And if you want your children to be able to stay on your health care plan until age 26, if you want to make sure that people with pre-existing conditions have coverage, and then that we cover especially the working poor, which is the large part of the population. When you think about folks in the Medicaid gap, you know, for folks who like to malign the poor and act like people don't have enough drive and get up and all of this stuff, nonsense. The people in the Medicaid gap are largely the working poor. These are folks who aren't quite eligible for conventional Medicaid, but they can't afford private insurance, and they're in the Medicaid gap. And they contribute to our economy in ways that are tough to quantify, but certainly a major part of our economy, and we need to make sure that they are covered. The other side doesn't have a plan. They're doing the bidding of the insurance industry, and we just need to make sure that all of our people are covered. It is important for the healthcare system, but I think it's also important for the economy. Again, the right thing to do, as it turns out, is the smart thing to do.
Wow, that's a great segue to the next question. Christian from Decatur has a question about the mental health crisis that has accompanied the COVID pandemic. He said, I completely understand the focus on beating the virus and ensuring the community's physical health. What steps can be taken to address the massive mental health crisis we have on our hands as a result of unprecedented isolation and depression? Not to mention the loss of loved ones.
Yeah, this pandemic has, beyond being unpredictable, has just been devastating to many communities. Most families or most people have either lost a loved one or know someone who has succumbed to this disease. To answer the question specifically, I think we all play a part in eradicating the disease. We all have to shoulder some responsibility when it comes to, social distancing, wearing our masks, and following all the guidelines. And they're not always for you. Many times they are for those who are more vulnerable than you. I think the sooner that we can, accomplish these goals that have been, laid out for us by our healthcare leaders, the sooner we can, get beyond and get past this pandemic. Unfortunately, there's been so much misinformation, and many people just don't know what to do, who to believe, or who to listen to. And I think that has certainly made, mental health more of an issue because there's no clear message. So I think from a healthcare professional standpoint, we need clear messaging, and we also will need to follow the rules that have been laid out. So I think that is a first step to solving any mental health issues. I think this country has already been burdened with mental health issues. This was just kind of an add-on or a pile-on. But I think we all are going to have to shoulder that responsibility by listening to CDC, listen to our thought leaders like Dr. Fauci, who has a clear, consistent message. And unfortunately, many people, depending on where you get your news, aren't hearing the message, and it's not resonating in all communities. So that would be one answer. Is there a solution there? I think we've got to unify our government, unify our speech, unify our language so that we can all be on one accord.
Thank you, Doctor. Just a quick technical note. I think our ASL interpreter needs her video turned on. Whoever's controlling the panel, who's hosting, please do that so that we can switch interpreters. Going on to our next question, Sarah from, yes.
I just want to make.
Go ahead, Dr. Sahib.
No comment. I don't mean to. I know
Yes.
time's running short, but number one, yes, there's clearly a mental health crisis in this country, and there are about 600 people on this call. If you know someone that is suffering from a mental health crisis related to COVID, there's a great 1-800 number that you can call. It's 1-8. Of course, now I lost it. 1-800-662-HELP. That's the federal government national hotline for mental health crisis. So if you know someone that's suffering from a mental health crisis, please reach out to them. It's a great resource. And there are a lot, and it's not just mental health, there's domestic violence, there's sexual abuse, there's elder abuse. And so if you're recognizing that or seeing that in your community, please do not be afraid to reach out to get someone to help those people, because most people that are suffering those types of crises, they're not able to reach out for themselves. So please take it on your behalf to help them.
Thank you, Dr. Sahu. And for those who are military veterans, it's 888-273-TALK, 888-273-TALK for the Veterans in Crisis hotline. And you can also go to va.gov, and there's a page, online chat function there as well. Dr. Kinsel, you raised your hand.
Yeah, I just wanted to point out a related issue. The pandemic has also exacerbated use disorders, substance use disorders, particularly opioid use disorders. Most people don't realize that the #1 cause of death for people under age 50 in this country is opioid overdose. The #1 cause of death for people under age 50. And at some point, we're going to have to deal with that without the stigma. Georgia is not quite as bad as that, but this is unacceptable for 30-year-olds to be dropping dead.
Thank you. Thank you. We have 2 more questions. We have 10 minutes, so I want to make sure we stay on schedule. Sarah from Peachtree City asked, how can we revamp the healthcare system to focus on preventative care? I think Dr. Ellis talked a little bit about this, about the people that come to him are in situations where they can't have a healthy lifestyle, or they don't have good access to nutrition, or they can't exercise, and it leads to the health conditions that they have. But what can we do within the healthcare system to focus on preventative care? Well, let me just say this. I mean, we've been talking about Medicaid expansion in Illinois. Medicaid expansion meant that a lot of people were able to get healthcare, preventative care, and it actually really helped our, especially in Chicago, in some of our community hospitals. They were able to really increase the quality of health and well-being of the local community, because people could finally afford preventative care. Everything from being able to take your regular cholesterol medication to all of the preventative stuff that has to do with preventing diabetes, preventing hypertension, all of that. But that came with Medicaid expansion, which is what we did do that in Illinois.
Right. And I certainly think that is a part of the answer, is an expansion of coverage for those who are most vulnerable. But it extends beyond that we talked about the cost of food, the availability of food, the availability of our kids to learn at an early age how important exercise is, and certainly being able to trust healthcare professionals. And that requires that we have healthcare professionals that look like the people who are in need. So a lot of this goes back to our inequalities in healthcare. They are so broad, but certainly starting with those things that I mentioned are a way to begin to bridge the gaps. We've got to tighten the net. I certainly think the Affordable Care Act and expansion of Medicaid is certainly one thing that will tighten the net.
Thank you. Our last audience question is from Lauren in Austell. She wants to know, what will you do to help folks who make too much to qualify for Medicaid, but can't realistically afford a private healthcare plan?
Part of what we've got to do is drive down the costs. And, you know, there are different aspects to that work. And Senator Duckworth, feel free to join in. And I mean, you're engaged in that conversation right now, but I mean, a lot of the costs are driven by the cost of prescription drugs. And we've got to expand care so that we need to get more people in the plan. We need sick people and well people, young people and old people, healthy people and not so healthy people in the plan. That's how you drive costs down. And there have been a lot of efforts by the Republicans over the last several years to gum up the system, if you will. The fight against the individual mandate, other efforts to, you know, that make it difficult to get care to as many people as we can, and also to drive down the costs.
Well, when you get here, Reverend Warnock, one of the things I would ask you to consider voting for, and you don't have to answer me now, but you can think about it, is there are two things that we could do with the Affordable Care Act to improve it. Number one, we can actually do Medicare buy-in and lower the age for people to buy into Medicare to 55 or even 50-year-olds. And this is about offering you choice. You get to choose to, if you want to, buy into Medicare and Medicaid. And when I talk to folks about that, I always talk about dropping it down to 55. So if you want to buy in, you can. If you like your private health insurance, go for it. You know, this is about you choosing to do what you want to do. But to have that as an option on that people could do that it would do two things. One, would let those folks who make too much to be on Medicaid be able to actually afford to have some sort of health insurance because they can buy into Medicare and get the power of Medicare. And it makes Medicare more viable because it brings in, as Reverend Warnock, you said, younger people into Medicare. And it actually helps extend the life of Medicare because you now have a younger pool to go in. The other option, which is something that I personally support, is offering a private, a public option on the exchange, so that the Affordable Care Act right now just has all private options. But I think to truly let the marketplace decide is to have a public option, and you can choose. You know, you can choose. Look, I get, you know, Kelly Loeffler and Mr. Perdue, they get great healthcare because they're United States senators. I'm on that same healthcare plan, right? And I get my healthcare off of the Affordable Care Act, off of the exchange, and I get to choose a gold plan, a platinum plan. That's what I have because I choose that. But you know, if you want to choose a private option, great. You want a little extra perks, great. But you should have this public option on the exchange, and you can choose to buy that, because that will be a way that you can have actually affordable health insurance and not have to get the junk insurances that Reverend Warnock, you were talking about, that doesn't actually cover anything. And it's got a deductible of, you know, $5,000, $7,000. What is that? That's no insurance at all. So those are two things: buy into Medicare and a public option, both of which would be pure choice on the part of the consumer. You can choose to buy it or not. It's up to you. So on that last note, I'd like to turn, ask the physicians that are on here, and then we'll go to Reverend Warnock for the final word. But if each of the physicians can go back to that question I asked earlier, what do you think our audience members should take away from today's discussion? If you were able to boil everything down to a single essential point, what would it be? What would you want the audience members to go away from this evening's discussion as their main thing that they should keep with them? And I'm just going to start because of the way my screen is. I've got Dr. Kinso up here, Dr. Sahu over here, and then Dr. Ellis, you're right in the middle of the screen. So let's start with Dr. Kinso.
And we've said this a number of ways, everyone deserves a right to life. And people interpret that in various ways, but the right to kidney treatment, the right to heart treatment, that's a very fundamental, life-saving, life-extending part of life. And I don't think we do that with private insurance. We always say, if you like your private insurance, you can keep it. I don't know anybody who likes their private insurance plan, and I don't know anybody who dislikes Medicare. If you start talking to people about taking their Medicare away, they'll fight you. When we have such a proven, simple, take out the Advantage plans, but when we have such a simple, reproducible plan such as Medicare, why the heck don't we just use it? It's so much easier for the healthcare system to use Medicare because you know what the rules are and you can work through the rules. And you start talking about private insurance, you're not going to get the help. You're just not. No one can work through it. Thank you. Dr. Sahu?
Yes, that's a good question. It's also a hard one. So I would say this as it relates to COVID. This is going to be a very long and hard winter. There are thousands of people across this country that will be having their last Thanksgiving with their family and their last Christmas with their family, and they don't even know it yet. 1,300 people died in this country yesterday. Statistically, we're going to have about the same number of deaths today. That means in this hour chat, about 55 people have died. It's going to be a brutal winter. And our most precious resource in that fight is not a miracle drug. It's our doctors, our physicians, our healthcare staff. We are that vital resource. And we just need a little bit of help. And we just need people to wear masks. We just need people to socially distant just a little bit. But probably the most important thing is that we just need people to believe in us. Like, no matter the color of your skin or the gender you identify or what other mechanism you identify yourself, we want to be there for you. And the way that we can be there for you is to get you through a critical illness. But we need you to be there for us just for a little bit because it's going to be a brutal winter.
Thank you. Dr. Ellis?
Thank you. I'm always amazed and fascinated by just listening to other doctors because we all have a different experience and a different story. And Dr. Sahu's passionate words certainly touched me. And I echoed the words of Dr. Kinsell. They all represent different aspects of healthcare. But I think for me, what I take from our discussion tonight is that healthcare is clearly a moral and an economic issue. And we've got to start being smart about our healthcare. I certainly think the Affordable Care Act is one way we can be smart. It's cost effective, it's proactive, and it's an efficient way for us to move healthcare into the future. As our population grows, we're going to be dealing, unfortunately, with more and more end-stage diseases. And if we don't get out in front of this by dealing with hypertension and diabetes and pre-existing conditions that will specifically be addressed by the Affordable Care Act, we're going to be in for a world of hurt in the future. So, I think this is such an important discussion for us all, and I certainly appreciate everybody's comments. And I hope that with the help of Dr. Warnock and his election to the Senate, we'll certainly, along with you, Senator Duckworth, get the job done.
Thank you. I mean, what a powerful and informative discussion we've had. And this conversation reminds me yet again of how important this runoff election will be. And with that, I'm going to turn it over to Reverend Warnock for the final word.
So let me see if I can defy Baptist gravity and be brief in my closing remarks. I am really grateful for these doctors and all of our healthcare professionals who are on the front lines of a war. You know, we're at wars just against a virus. And we've got to use the tools to save as many lives as we can. I'm grateful to Dr. Kinsell. Karen Kinzell's out there in Clay County, the only doctor in the county. And she's been fighting the good fight for years, but rather than celebrate her for her heroism, which she deserves, we need to be trying to get her some help and trying to strengthen rural health care. That's not a medal or badge she wants to carry. And, you know, she and others in similar situations, we need to, which gets to the pipeline, which I heard Dr. Ellis sort of speak of in a way to create the pipeline of doctors from diverse places in our country, that we get our children ready and in the pipeline so we have healthcare professionals in these communities. I'm grateful to Dr. Sahu, who I met a while ago, who just moved me when he told me months ago about what he was going through as a cardiologist and coming home and having literally to strip in the garage in the midst of the COVID-19 challenge so as not to endanger his little children. And I have small children who would, you know, naturally gravitate toward dad, trying to keep his family safe and save lives at the same time, and who has reminded us of what's at stake and that we owe it to our doctors and others, and we owe it to ourselves. Put on a mask, socially distant, wash your hands, watch your distance. And Dr. Ellis, who, as a kidney doctor, sees in many instances the failures in our healthcare and the ways in which we provide healthcare, that many of his patients shouldn't have to be his patients in the first place. They didn't necessarily have to be in this situation. And so know that I'm taking your stories with me as I make the case for this runoff election. And I'll be taking that passion and commitment with me to the U.S. Senate, hopefully to join Senator Tammy Duckworth, who has served our country in so many important ways. She's laid it on the line as a soldier, and now she's a soldier in this war. And I'm deeply honored to be here with you tonight. So thanks everybody for joining us. Tell everybody early voting begins December 14th. December 7th is the last day to register to vote. January 5th, the road to winning the future for all of our children. I was saying this during the general, but there are a lot of Senate races going on, but there are no challenges to my assertion tonight that the road to the future in the United States of America, without fear of contradiction, runs through the great state of Georgia. So let's make it happen.
Let's make it happen. Make sure you vote. Make sure your loved ones vote. Make sure your friends and family members vote. Make sure people you don't know vote early, and make sure that your vote counts. Thank you everyone for being here tonight. Have a wonderful, wonderful evening. Go hug the people that you love, and pray for those who may be ill right now. And thank you all, and God bless.
Good night, everybody.
Good night.